Okay, dear all, Dr. Vishal from Vishwa Medical Coaching, and this is a very nice doubt my student has asked after the student has gone through our diabetes lecture. Now remember, diabetes is the most common metabolic disorder, and the student is asking doubt like, for example, if the patient is not having any diabetes, to prevent diabetes, we have discussed in a lecture that we ask the patient to avoid having food all the time. That means every hour they are having something or the other. That is what we ask the patient to avoid, so that the diabetes will not be developed. Diabetes will not occur, to prevent diabetes. And on the contrary, we have discussed that if the patient already has diabetes, we ask the patient to have a small frequent meals. So why exactly this controversy? That means to prevent diabetes, you are supposed to avoid having food all the time, more frequently, and when patient already has diabetes, we ask the patient to have a small frequent meals. Small frequent meals. So why exactly this is so? Now remember, for this we need to understand about the metabolism as well as normal scenarios and a diabetic scenario. Now let's say, for example, if the patient already not having any diabetes, patient has got normal pancreas, normal insulin secretions, normal receptors. If the patient has food all the time, every let's say, for example, having food every now and then, what will happen is insulin will be secreted more and more frequently rather, and that more frequent insulin release will stimulate the receptors, and that frequent stimulation of the receptors, insulin receptors, will create a desensitization, and there is more chance of patient going into diabetes because of that desensitization. So before developing diabetes, we have understood that we are not supposed to have food every now and then to prevent diabetes. Now, in a diabetic situation and a diabetes situation, understand pancreas is already become weak. Of course, the metabolism problem starts with desensitization of the receptors, but later on the pancreas becomes also weak. So, if the pancreas is weak, remember, if the patient has bulk of food the single time, let's say, for example, patient is supposed to be having 4 chapatis in a day, let's say. So, if the patient has all 4 chapatis in the single time, what will happen is pancreas has to digest those 4 chapatis, glucose of those 4 chapatis. The pancreas has already become weak, so there is a less possibility that the patient will be able to digest that 4 chapatis in a single sitting, and the sugar level will go up because the pancreas has become weak. Patient already has diabetes. So rather than having 4 chapatis in a single time, we ask the patient to have 2 chapatis 2 times, so that at one time pancreas has to digest, release insulin for only 2 chapatis. So the sugar level will not go up. So amount of food patient is going to have the same, but if the patient has got small frequent meals, the escalation of the sugar level will not occur, and the patient will have neovascularization problem or the diabetes complications, because diabetes complication depends upon number of times the sugar is escalated in a lifetime of the diabetes. So that is the reason we ask the patient to have small frequent meals when the patient has diabetes, and we ask the patient to have not to be having food all the time to prevent diabetes. Remember, these are the two situations we need to understand practically. Thank you so much.